So I think there were two things. Firstly, I don't think people believed what was coming out of China was going to be relevant to us. And secondly, we had this cognitive bias thinking it was going to be influenza. And I think it basically did take us till early March before we woke up and realized what had happened.
What's up, you scholars of enlightenment? Today we're going to be discussing the UK government's questionable record regarding the ongoing COVID-19 pandemic. And joining us to do that is a fascinating, high profile, and I don't think he'll mind me saying outspoken special guest, Professor Richard Horton. So Richard, welcome to the podcast.
Sam, it's great to be with you. Thank you for inviting me.
Thank you very much for taking the time. So Professor Horton is the editor-in-chief of the Lancet, a very prestigious UK-based medical journal. And he's also an honorary professor at the London School of Tropical Medicine, the University College London, and the University of Oslo. And he's been a medical writer for The Observer, the Times Literary Supplement, and the New York Review of Books. And before we go any further, we should also say he has a new book out on the current, we'll get your plugs in early, Richard, don't worry. The current COVID-19 pandemic and I've got one.
Oh, you have a copy.
I've got one, don't worry. And the failures of the government around the world to respond to it coming down the track. So great time to have a chat. I will admit, it must be going well because Amazon didn't send me it on time. They sent me it in the second shipment. So I haven't had time to get through it fully, but I've read some online criticism, still got some good questions. First up then, how is the book being received?
I think it's being received well. I mean, I wasn't trying to write a thorough history of the pandemic. What I wanted to do was to write from a very particular point of view, as someone who has been responsible for publishing a lot of the science that has informed the pandemic. And sitting in that particular place, I've been very gratified by the response. I think people think I'm very angry and outraged, and I am partly angry and outraged.
And honestly, it's sorry to say this, but it's a national scandal. We shouldn't be in this position. We knew in the last week of January that this was coming. The message from China was absolutely clear that a new virus with pandemic potential was hitting cities. People were being admitted to hospital, admitted to intensive care units and dying, and the mortality was growing. We knew that 11 weeks ago. And then we wasted February when we could have acted. Time when we could have ramped up testing, time when we could have got personal protective equipment ready and disseminated. We didn't do it. I'm hearing that not just personal protective equipment is not available, it's the wrong kind of personal protective equipment. What we have isn't even WHO standard. We're putting our health workers, who we've just all clapped here, in the front lines without the armour they need to defend themselves. They're wearing surgical masks which are not WHO standard. They're wearing thin plastic aprons which are not standard. And they're wearing rubber gloves which only cover their wrists, exposing their arms to danger, jeopardy. That is nothing short of a national scandal. How could we allow this to happen? The hypocrisy of clapping NHS workers and yet the government not supporting them to go into that front line is tragic. And it was preventable. I'm sorry to say, but it was preventable.
But I'm very positive about the scientific response, which has been unbelievable, actually. I don't think, we've ever seen an event in history where the scientific community worldwide has literally dropped everything and just responded en masse. It's been remarkable.
Yeah.
And also, although there are lots of criticisms about the way countries have responded to the pandemic, I also want us to look forward, because I think that there are things that are within our control that we can write a different story about our life for going forward. So the book tries to at least touch on some of those areas.
And
so
have a positive message rather than just being
a positive,
doom and gloom. Yeah,
exactly.
Good. So we'll definitely come on to some of those aspects. First of all, I wanted to get into the sort of title of the book. So it's the COVID-19 catastrophe, what's gone wrong, and how to stop it happening again. So you've said that the UK response to COVID-19 is one of the greatest science policy failures for a generation. And I want to understand what you mean by wrong and policy failure and define those terms. So are you indicting the outcomes that we've seen so far from government policy, so the UK having one of the highest death rates per capita, or is it specific actions? Because we have to be careful, don't we, at the moment? There's obviously the two are correlated. It looks like certain countries like Sweden that had more softly approach have higher deaths. But the experiment's not over. There's chance of recurring spikes. As we saw from Public Health England last week, a lot of the data is a little bit iffy. There's not a sort of top-down way of looking at how these deaths are categorized. So I've been a little bit reticent as a scientist to sort of wade in and say, this country's done great, this country's done poorly, before we sort of have all the data in. So why do you say it's been such a failure? Is it specific actions?
Yeah, and I agree with you, and I agree with Chris Whitty, the Chief Medical Officer, when he says you need to look at all-cause mortality in the end, because you need to look at the indirect effects of the pandemic. Well, the reason does go back to that last week of January, and when we published 5 papers in that last week of January, those 5 papers described a brand new virus that was not influenza, that was a SARS-like virus, which had an origin from, had a genetic sequence that really took you back to the kind of virus that was in 2002, 2003 in China. It was a virus that was causing a very mysterious illness. Although patients were presenting with a viral pneumonia, when they were admitted to hospital, a very high proportion were ending up on intensive care, not because of their viral pneumonia so much, but they were developing multi-organ failure. So they were developing acute injuries to the heart, to the kidney, to other organs. This cytokine storm, as it's called, this massive outpouring of inflammatory chemicals, which was causing this bodily explosion and killing people. The papers that we published showed very clear evidence of human-to-human transmission. And then in it was a beautiful piece of work actually by Gabriel Leung at Hong Kong University. He then looked at all of the evidence about where people might have traveled from Wuhan. It was a very unfortunate. Wuhan was the place where the outbreak began because it's a central transportation hub, both within China, but more importantly, internationally. And when he looked at the extent of the international flight connections and the time between the infection starting and before the authorities started to do anything about it, he saw that the risk of a global pandemic was very, very real. And so he predicted that there was going to be a global pandemic. In these papers, they also were referring to the urgency of getting personal protective equipment ready, of getting test, trace, and isolate systems up and running, of people avoiding mass gatherings, thinking about closing schools, and so on and so forth. In other words, the entire story that we have lived with for the past 5 to 6 months was told in those 5 papers. So the reason why I think we took the wrong actions were, we locked down on March the 23rd and we were waiting for Imperial to come up with the magical formula in its estimations of mortality. But that was wrong. We knew that this virus, we had to stop it running through our community. And we followed this policy of herd immunity, which was absolutely the wrong policy to follow for a virus with a 1+ percentage point mortality rate. So I think if people had read those 5 papers in the last week of January, we would not have made the mistakes we've made. And that's not just on UK, that's across most Western governments.
Yeah. So I think that the thing that binds together a lot of your criticism is that essentially that time was wasted, right? We had this first Chinese case in November 2019, the first UK case in January 2020, and the papers were there, the work had been done to show that this could potentially be a global pandemic producing virus, and yet that time was wasted. So if we look at sort of the two strands of where information was coming from, those Lancet papers you talk about and maybe the Chinese experience, why do you think the information in those particular Lancet papers wasn't taken up with a vengeance? Why did it not make the splash that it should have done?
Yeah, I mean that is a mystery too that I'm still pondering today, because we're very fortunate in the UK in the quality of our scientists. Yeah. I mean, we really are second only to the United States, I think, in terms of the depth and breadth of the science that we do. But what we've done is we've constructed an extremely complicated system for generating science policy. So we have the Chief Medical Officer's office, and it's not just the Chief Medical Officer, there's a whole army of people around him who support him. The Chief Scientific Advisor, it's a smaller office, but still with support. Then we have SAGE. Then we have SPI-B and SPI-M, which report into SAGE. Then we have NerveTag. Yeah. So you imagine, you've got these four or five or six different groupings, and they're all meeting, talking about often the same thing, the same evidence, and they're all kind of reporting into each other. But the problem is nobody's assuming central responsibility for the advice that goes to government. You've got so many different groups. NerveTag has to make a judgment about what's the risk level in the UK. Well, okay, it makes a determination. So does Public Health England make a determination. So does NHS England make a determination. It's too complicated.
A bit too fragmented.
We are world class in our science, but we constructed this unbelievably Byzantine system, which meant that there was not one person or one group that was standing up saying, we have a SARS virus that's killing people in China and is now traveling around the world and is on its way here, and we need at the beginning of February to be figuring out what we're going to do and acting. And what we actually did was we talked and we talked and we talked and we talked all the way through February and early March, and we didn't do anything.
And we wasted time.
We wasted 6 weeks, Sam.
Yeah.
And we were on a doubling time. In the end, we were on a doubling time of this infection ripping through our communities of something like 3 days. Every 3 days, it was doubling. Yeah. And when it's doing that with a 1% mortality, especially with, once it got into care homes and affecting older people with chronic diseases, that's where you get the 40,000+ deaths.
Yeah, yeah. So I wanted to come on to, I mean, this is very much in your wheelhouse. We talked about those papers that came out that could have been seen and could have got us to act faster. What do you think is the role of peer-reviewed science in a fast-moving crisis like this? So for a bit of background, in 2007, the Lancet, I believe this was during your editorship, posted a very scathing paper that suggested the World Health Organization, recommendations relied far too much on expert opinion and not enough on the peer-reviewed science. But this sort of high-level gold-plated science, it can't happen at the click of a finger, especially with the high standards of science and in a fast-moving crisis like this. And we've seen problems in peer-reviewed science with regards to COVID. So a lot of people can't even determine whether masks are helpful or not. There's people on different sides of this debate. The WHO has changed its recommendations on this. We've seen the World Health Organization put out tweets saying they didn't think there was much human-to-human transmission. Then that's gone down. Yeah. We saw PNAS withdraw a study. We even saw a problem at the Lancet.
We had to retract a paper on hydroxychloroquine, exactly.
Which basically scuppered those trials. So the disinformation or failure of information can also have impacts. Under those circumstances of a fast-moving crisis like this, is it perhaps inevitable that government responses are different and expert opinion gets elevated to some extent because the peer review science lags behind, and we need time to be able to do it? There's still a lot of unknowns as well.
There's a lot of unknowns. There is a lot of unknowns. But here's what I think should have happened in that last week of January. So you're sitting on one of these committees and you see these 5 papers come out.
Yeah.
Now you look at that and you think, wow, okay, I'm sitting here in London. This is being reported from Wuhan or Beijing or Shenzhen or Hong Kong. What do I do? What surely one should do? I mean, you know, the scientific community is a transnational community. So the people who are key in China, being the kind of country China is, you can count on the fingers of one hand almost, the people who decide things in Chinese science. President of the Chinese Academy of Medical Sciences, a guy called Chen Wang, a guy who is the former Minister of Health and has a very senior position in the Chinese government. He's a molecular biologist from Shanghai, a guy called Chen Zhu, who's been given, I think he's a fellow of the Royal Society. A guy was trained in Oxford and is now director of the China Centers for Disease Control, a guy called George Gao. So we know these people, and we can, I mean, drop them an email. Dear George, dear Chen Wang, I've read these papers in the Lancet.
Yeah.
It looks pretty serious. Is it?
Yeah.
Is this something that we should be worried about in the UK?
Yeah.
Or is this just a local outbreak and it's going to fizzle out on its own? I mean, why weren't we in touch with these people? And we were in touch with them because they were sending the papers to us. So this is what I don't quite figure, that even if you looked at these papers and you thought, well, this is a long way away from the UK, 3,000 miles away from Britain, why should I be worried? You should have a sensitivity to a SARS-like virus because we knew from 20 years ago how serious that was. And we should have then reached out and tried to find out more information. So, but we didn't. Yeah. We didn't.
So I think there's two strands.
I don't understand that.
There's 2 strands there, isn't there? Why didn't we reach out to China, and how can we shore up our peer review process? So maybe if we deal with the peer review first, how can we shore up against these failures that we've seen in that peer review process? And then we'll come on to, as you say, that we could have short-circuited that by having a chat with the people who were on the ground in China while this thing was raging over there.
I mean, for the 5 papers that we published there, and for the overwhelming majority, there's only one instance in the last 6 months that has affected both the Lancet and the New England Journal of Medicine where we've had to retract a paper.
Yeah. So you don't think it's too widespread a problem, even with the fast-moving nature?
I think what we need to admit is that for the papers retracted at the Lancet and the New England Journal of Medicine, this was a fraud. This was fraudulent research.
Yeah.
These were data that were fabricated by an individual. So this was essentially a science crime. And if you look at science as a microcosm of society, sadly, there are people in science who commit science crimes. And every few years, you have a moment where somebody is exposed and papers have to be retracted as a result. That happened here for both journals. Of course, I wish it hadn't happened. I wish we hadn't published the paper that was clearly fraudulent. But the problem with peer review is that peer review is a very bad system for figuring out whether crimes have been committed.
So it's more looking at the analysis of the data that's been given, but not necessarily knowing if the data collected was correct.
Exactly. You know, peer review is not about looking at the raw data. Nobody's going into the lab where this research was done, or in this case, the database where this research was done, and checking every single number. What we were doing was you take the paper on trust. Now, the problem for science is if you then say every single piece of research you're going to believe is a potential lie, well, the whole system breaks down, doesn't it? I mean, you've got to, the system of science and science publication depends upon you believing me and me believing you. But if we start off our conversation, if you submit a paper to me and I'm thinking, you're a lying bastard and I can't ever believe anything you're going to tell me, well, we're not going to get very far.
So maybe it's about requiring people to submit the raw data and maybe the analytical code that they've used as well. Maybe that would help. But as you say, it's difficult and it slows down the process, particularly in a
fast-moving pandemic. I mean, we could never ask our editors or peer reviewers to check the raw data. I mean, I don't think that's feasible. But what didn't happen here, and should have happened, is that all of the authors should have taken responsibility for verifying the accuracy and reliability of the raw data. And they didn't. They didn't. They took it on trust from one person, and that was a mistake.
Fair enough.
And so what we're going to do in the future is we are going to absolutely make sure that all authors verify the data that they're reporting. And take responsibility for it.
Sounds like a positive step forward. So the other place that you said data was coming from that you alluded to was obviously from China, which was hit by this first. So China had been sort of surprised by SARS back in the early 2000s, and it sort of learnt from that experience and it acted relatively decisively. We could see these disturbing pictures coming out of China in the early part of the year, people being locked into buildings, dead people in the streets, things like this. On the 30th of January, the WHO declared a global health emergency. And you say that essentially should have been a wake-up call to the rest of the world. You said that we didn't talk to China as much as we could have done. Why do you think that happened? What was it? Because of these accusations of data being sat on, medical staff being gagged, things like this? Was there a distrust of that data, or was it just essentially insular thinking? You know, this is going on in China. It happened in China with SARS. It never really got over here. Sort of fizzled out. Why do you think we didn't bother to sort of really safeguard ourselves, if that's the right word?
I think two reasons. The first one is that I think you're right. I think there was a skepticism about the accuracy of and reliability of the information coming out of China. I think that there was a view, well, this was a local outbreak in China. Perhaps the Chinese health system isn't very good. Perhaps they can't manage these patients very well. So perhaps it's worse there than it would be here.
It certainly did seem that we kicked up our response when we saw Italy going down, a modern European country, westernized country. Sort of.
We only woke up when Lombardy went into meltdown. But I think there was a second reason, and this is the difference between, I think, the New Zealand response and the UK response, and that is that in Asia, everybody was totally scared to death about SARS back in the early 2000s, and I think they had ingrained a memory into their political systems where they thought, SARS was a real killer, real killer.
And we need to learn the lessons and play it safe.
And they really had learned the lessons, whereas the pandemic modeling in Europe and the United States was for influenza. Now, influenza is a nasty condition, no question. And some years, 20, 30,000 people in the UK will die of influenza. But we've absorbed that. We've kind of normalized influenza into our daily lives, and there's a vaccine every year. And so we don't get very panicked about influenza. And we were modeling for a flu pandemic. And so although the data showed in January that this wasn't flu, we were still thinking flu. Through February and March.
I remember before I went away, we were talking about this is going to be like the Spanish flu. We're going to have a lockdown at some point, but we don't want to do it too hard because we want to build up some level of immunity so we don't get this horrible second spike. And it was only sort of can't remember the exact time, but sort of March, April, when this Niall Ferguson modelling came out, that the people sort of turned around and then was like, oh no, we need to lock down quite rapidly.
Because it was in early March that he got the data from Italy, which showed that the admissions to intensive care were double what he was modelling for.
Yeah.
And he was modelling for a much milder pandemic of something like flu. But then when he saw that it was so much, he put those numbers into his model, and it was like, the NHS is in meltdown. So I think there were two things. Firstly, I don't think people believed what was coming out of China was going to be relevant to us. And secondly, we had this cognitive bias, thinking it was going to be influenza. And I think it basically did take us till early March before we woke up and realized what had happened. But I think the other part of this is then that, because that's all the science, and the other part is the politics. And we have a government that didn't want to intervene. Actually, we have a government that is very libertarian in its views, and was doing everything that it possibly could not to restrict liberties, which was ultimately also contributing to the mortality.
That's a difficult one, isn't it? Because that's as you say, we're wandering off the science then and into the sort of the dirty business of politics.
But it's also public health. You know, there's this in the world of public health, which I guess I'm partly in. You know, every time we write an editorial that's making a recommendation about intervening in population health, people will say to us, "Oh, look, it's the nanny state again. You know, you want to restrict our freedoms." What we eat, what we drink, alcohol's bad for you. Drinking this kind of drink is bad for you. You know, telling me what diets I should have, and I understand that, and I think the government, this particular government, is very much of that view. That yeah, sure, experts, so to speak, scientists, have all this evidence which says that we should do this and we shouldn't do that, but there is a political philosophy that's perfectly legitimate, which actually wants to restrict the intervention of the state in people's lives. I understand that, but
well, I'm quite on that side of the spectrum. I don't want the state intervening, but here we have, the way I look at it is, here we have an externality, right? Me wandering around doing things is potentially going to hurt somebody else. I'm not an island, so I can't just be like, oh, I'll just wander around and do whatever I like. At some point, unfortunately, you have to accept a restriction on freedom to lower those externalities to other people. So there is a place for these kind of interventions. It's not doing them unnecessarily, but nobody would say, or not many people would say, that in a pandemic situation, there's no role for the state to play in restricting certain things for a reasonable amount of time.
Well, I agree with that, but look at the recent debate over mask wearing. You have Michael Gove one day saying that it's just courtesy to wear a mask, but then on the Monday we make a decision. The government makes a decision that it's going to be mandated by later in July. So, you know, I think I understand the reluctance to intervene, but when somehow the science, and this is another question, the science didn't seem to be getting through to the politicians. The science on masks, the reason why it's solidified in recent weeks is that we now understand better than we did 4 months ago, that this virus is transmitted from asymptomatic people, and we didn't know that as much as we know now. And secondly, that there's airborne transmission. And so the fact that people who are perfectly well in themselves could be transmitting the virus and it's just hanging in the air means that wearing a mask becomes a more obvious thing to do than when we didn't know that. So, you know, we didn't seem to be getting that science to the front line of politics. And again, is that because we have politicians who are not very well trained in science? Germany's response is interesting. You have somebody who's got a PhD in science, a scientific background as chancellor with Angela Merkel. she can understand the papers that are published. She understands data, and she can interpret that. Germany has had a far better response than we have. We've got people in politics who don't have such strong scientific backgrounds. So I think there's a very interesting question about the role of science in government.
Yeah. Definitely I don't think I'd want Boris Johnson reading the science papers and then running off for policy. But I understand what you're saying. And I completely agree on that.
But wouldn't it be nice if we had some politicians as leaders who actually had trained in science, so they could understand what significance was, what risk was, what hazard ratios mean, and feel comfortable with quantitative information and being able to interpret a graph I mean, they're basic things actually, but they're fundamental to understanding the data that's informing a pandemic.
Yeah. Well, you're definitely going to get no argument from me on that as a fellow scientist. So maybe if we go into because I wanted to get a little bit into it. It's not a nice thing to go into, but who's to blame? So I want to get into a little bit of who's responsible for this. So you've called for a national and international inquiry into this pandemic, which Boris Johnson has said he's on board with, although he suggested it's going to be a long way down the track, I think.
Yeah.
And you've laid some of the blame at the feet of both politicians and scientists. So if we start with the politicians, because it's always an easier sort of punching bag, you know what I mean? And then we'll go into the scientists. So where do you think the politicians went wrong on this? Because do you think these failings were malicious, or as you sort of alluded to there, do you think they were just incompetence and having the wrong focus, perhaps?
Well, I think in the UK's case, I mean, I think the answer to that is it's different for every country.
Because you have to be careful that you can't just say that lockdown is always a win, because there are other things on the other side of the equation. There's the economy. We've just had I believe yesterday, a report come out to say that there could be 200,000 more deaths because of the impact on the economy, the impact on more deaths from suicide, domestic violence, people losing their jobs. So it's not a case of just lockdown is amazing and a panacea. There are political decisions that the government needs to weigh up, and we can say they haven't gone hard enough on one side or the other, but it's not just a lockdown and everything's fine, is it? It is difficult for politicians to decide where to set those dials.
No, it is difficult, and you've got to be careful about hindsight here. But I still maintain that we knew that you have a virus with a high in-hospital mortality rate that's human-to-human transmission, that is related to SARS. We knew that, and we also know that the only way that you're going to stop that virus from ripping through the community is by reducing the lines of viral transmission. You've got to stop it transmitting from person to person. And the only way you can do that is by, hand hygiene, respiratory hygiene, but also physical distancing, working from home, not having going to the Cheltenham races, stopping all mass gatherings. So those and the evidence on mass gathering medicine's been growing for years because of pilgrimages and football matches and the Olympics. We've developed a very reliable knowledge base about the contribution of mass gatherings to infectious disease. So I know it's difficult, but I still don't fully understand how we go from very secure knowledge at the end of January to knowing that we have to stop the lines of viral transmission, and we're not doing it. Now, the reason why we didn't do it, and it is on the record here, and you can hear Boris Johnson say it, and you can hear Patrick Vallance talking about it, and other members of science advisory groups. We were following this idea of herd immunity, that in the absence of a vaccine, the only way to stop transmission is that we all get the infection, or a very large proportion of people get the infection, and that kills community transmission. And again, what was so wrong about that was we were going to have a huge mortality to enable herd immunity to work. So for the politicians, I think this is where, when you don't have scientifically literate politicians, they don't know the questions to ask. Because the questions they should have been asking were, what's the mortality rate?
Yeah.
How easily is this virus transmitted from person to person? What is the disease process? So when they get admitted to the hospital, is it just like the flu? Or why are people ending up on intensive care? How do we stop the epidemic spreading in the population? I mean, these are the sorts of scientific questions that you would ask, and pieces of research will try and answer. But they didn't seem to ask those questions. And that's the failure of politics. The politicians can't keep saying, we follow the science, because the politicians have to take responsibility, not just for decisions, but for interrogating the science. They should be asking questions of the scientists. They should be saying, well, how do I stop? How quickly does this virus transmit from person to person? How easily? And how do I stop it from doing so? And then also modeling the effects of a lockdown, both the positive effects for stopping transmission, but also, as you rightly point out, the potential negative effects. So I don't think the politicians were curious enough to ask those questions. And the political context was, and I hate to do this because I don't want to bring up Brexit particularly, but on the same day that we published the last paper in this sequence of 5 papers, on January the 31st, Boris Johnson gave a speech in which he declared the success of Brexit. We were now leaving the European Union on January the 31st, and we could look forward to this golden future. So I think the politicians' mindset was not about the risk of a pandemic. The politicians' mindset in Britain was, we've got Brexit done, now we have this wonderful future to look forward to. And the last thing they were thinking about was, oh my God, there's a pandemic around the corner.
So it got lost in the
It got lost. It just got lost. It got lost in the celebration and chaos of Brexit.
It's interesting what you say about this sort of more libertarian attitude, and perhaps that is emboldened by having a big majority and this type of thing. But it doesn't. On the political side, it doesn't seem like a good strategy of a conservative government to be letting a virus that kills a lot of older voters, shall we say, to be, quite morbid about it and quite on the nose about it. It doesn't seem like something they'd want to do, but also, as you say, they don't want to intervene. So it feels more incompetence here than malicious.
Oh, I don't think anybody was malicious. I genuinely don't. I think, and this is where we should be careful about the word blame. I don't want to blame any individual. I do want to understand the accountability, the lines of accountability. But this is a system failure. I'm very old enough to remember the Bristol Heart scandal from years ago, going right the way back into, what was it? It was the 90s or early 2000s, where there were operations done at Bristol Royal Infirmary, and the mortality amongst children who were operated on was way too high, and there was a big inquiry that Sir Ian Kennedy chaired, and it was an awful example of failure. Now, there were individual failures, clearly, because surgeons were operating on those children. But the failings were not just individual, they were system failings. The system failed. The system shouldn't have allowed those surgeons to operate. The system should have picked up the fact that the mortality was too high. The system should have stopped them operating. So the system went wrong. And I think that's the case here, that the system of science, first of all, the system of picking up signals of danger didn't pick this one up. The system of evaluating those signals didn't evaluate it properly to realize what was happening. And then we didn't transmit a sense of urgency about those signals to politicians and policymakers. Now that is a system failure. It's not, I'm not going to say Chris Whitty is to blame. Chris isn't to blame. I know Chris Whitty. I've worked with, he's a great guy. He's a super good chief medical officer. Patrick Vallance is massively experienced in so many different spheres of science. He's an excellent chief science advisor, and all of the individual science people who sit on these various committees, in their own way, they're excellent. But what I want to know is on SAGE, why
so
wasn't...
let's move into the scientists then, because you
yeah,
also say there was, you know, there is some blame on the side of the scientists. So
there's responsibility again on the system. So to take an example, on SAGE, there was nobody who was an expert on SARS from a clinical point of view. Because if somebody had seen those Lancet papers and had been sitting on SAGE, I genuinely believe they would have said, hang on, folks, this disease is really serious and it's got a really high mortality rate in certain groups of the population. And if this virus starts seeding itself in the UK, we're in deep trouble. And I think then that would have really upped the signal of concern that was coming out of SAGE. But we didn't have a respiratory physician or an intensive care physician on SAGE. We didn't have an expert who knew about SARS. And this, I think, was the limitation of modeling. We've put all of our eggs in the basket of modeling. And modeling is super important, don't get me wrong. It's got a very important part to play. But we were all, I don't know if you remember, in January and February, we were literally hanging day by day. What's the latest evidence from Imperial?
I remember.
What's Neil Ferguson going to say today?
I remember.
You know, he was brought onto the Today program. He was interviewed as if he was this godlike figure who was going to tell us the path that we had to take. Well, this is madness. Models are just models. And then if they're not being informed by clinical information from the front line, which they were clearly not being, because the front line was in Wuhan and they were not informing those models.
Right, it's junk in, junk out, isn't it?
Exactly. It's junk in, junk out. Exactly. And as you rightly say, it wasn't until it was in Lombardy that they woke up to what was going on. But we should have had the people who understood pathology, clinical presentation, and the virology. We should have had those people involved in SAGE from the very beginning. So we do have a scientific advisory group on emergencies, but I think we didn't have a broad enough scientific advisory group to evaluate what was actually taking place in Wuhan.
Well, we saw the setup of independent SAGE as well, didn't we? To sort of have less of a modelling approach and more of a sort of public health approach, if that's the best way to sort of describe it. So there were people who were sort of pushing against the more narrow way that we were assessing the scientific information in those early stages.
Yes, exactly. It was I think that the independent SAGE it has got, although it's a lot smaller, it's got public health advice. It's got broader clinical advice. It's got people who understand the issues around racial injustice, so who are representing Black and minority ethnic communities better. There is a modeler on independent SAGE, so modeling has its place, but it's one small part. Instead of it being, pretty much the whole of what SAGE is, it's just one small part. And so the wider context is informing what the modeling is telling you, and that seems to be right, and actually I think is one of the lessons to learn from this.
So we talked a little bit about some of the real failings and that wasted time. So we didn't get track and trace up quick enough, and it's still struggling to sort of get off the ground to help us clean up these hotspots of the virus. We didn't stockpile PPE, which we potentially should have done. We might not have locked down quick enough, and that gave us a higher peak. So these sort of wasted time ideas. Stepping back a level, why do you think, not just thinking about those couple of or 6 weeks that were lost, why do you think we've lost years not being ready for a global pandemic like this? Why do we not have that response that China has? Is it just because we haven't seen that situation and we've been lazy and assuming it wouldn't come to us? Because we had this exercise Cygnus, I believe, the simulation of a major flu pandemic that was undertaken in 2016. We had calls under the Gordon Brown government to be stockpiling more PPE, which is, 10, 12 years ago now. And it doesn't seem like over successive governments of both sides, we didn't really get ready for a global pandemic. Why is that? Is it just not a sexy subject and focus and money's gone elsewhere to voters are not particularly interested in it? It doesn't seem like something that impacts their everyday lives until it happens.
Well, here I am more sympathetic with politicians, because what you're being asked to spend money on and prepare for is a rare and random event.
Yeah.
And if you're a politician and you've got a very limited budget and you've got 5 years or 4 years in power, it's it's a big ask to say, I'm going to build a resilient health service, and I'm going to buy all the PPE in the world, and I'm going to make sure I've got vaccine production capacity and test, trace, and isolate, and all of this.
Yeah.
I'm going to spend billions on preparing for a random rare event that may happen tomorrow, but is probably most likely to happen God knows when.
It's a tough sell rather than I'm going to give X million more to schools or hospitals.
It's really, really hard. It's really hard. Now, however, perhaps it needs to happen to show that if you don't spend that money, you basically crash your economy, and it's the worst economic crisis for 300 years. So that money now seems actually a very worthwhile investment, a very small amount of money, and we are going to have to do it as we come out of this. I think that's the reason why, because I think it's a confirmation bias. I've never seen anything like this. You've never seen anything like this before. Therefore, we don't think of it in the realm of possibilities of our life. This was the difference in China. They had gone through SARS, so they didn't have a confirmation bias. Or their confirmation bias was outbreak in Wuhan. First thought, SARS. Lockdown, January 23rd. Don't wait, just do it. And that was the difference. And we will learn the lesson from that.
No, I think there's some truth in that. I mean, it is easier, I guess, to lock down in China under their government structure as well. But you're right. You have that experience and you think, God, we don't want that to happen again.
Yeah, and they were so humiliated. I mean, back in 2002, 2003, that was a serious national embarrassment to the whole world, because they lied to the world. The Chinese government lied to the world. They tried to deceive the world, and they were found out to be lying. And they knew that they couldn't go through that again. And so, I know there's a lot of discussion about China today and about a whole host of issues. But on this particular issue, as I've said in the book, we owe a debt of gratitude to those Chinese scientists for what they did.
Richard, that's extremely fascinating. Thank you so much for going through all that with us and giving us your views on that. I was really hoping to pick your brains on the how to stop it happening again and where we go into the future, which is the sort of second part of the tagline of your book. But I know you're a busy man, and maybe we can do that another day. I'd like to do that, and we also need to schedule the reverse where you get to pick my brains on the
Large Hadron Collider.
So we'll do
particle
that one day.
Physics.
Just before you go, we were talking about the peer-reviewed science that is available out there. Where can people go to keep up with the best science out of the Lancet and the things that you're saying, the things that you're putting out, the opinions you're putting out? Where would you like people to go?
So on the Lancet website, there is something called a Coronavirus Resource Center.
Yep.
And it pops up as soon as you get to the homepage of the Lancet. All the information we're publishing on COVID-19, anything to do with the pandemic is there. It's all freely accessible. You don't have to pay a penny to get in. It's all, you don't have to register. It's just all there for you to read if you want to. I think we're over 1,000 items that are up there now that are in the last 6 months. And it gives you I think it gives a very good global perspective on where the pandemic is currently, and where we're going in the future. And there's always exciting science that's published there.
Awesome. I'll put all those links down below in the description, so everyone head over
Thanks,
there and have a look. Richard, thank you so much for having this discussion with me.
Of course.
And hopefully we'll get onto that second part at some point when you've got another half an hour. Richard, thanks a lot, and have a good rest of the day. See you later.
Thank you too. Cheers, Sam. Take care. Bye-bye.
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 Bye-bye.